Welcome, team. It's Tuesday night and my name's Jacqui Lewis and I am the clinical nutritionist for BN Multi, and each week on Tuesday we join on the BN Multi page at 7 p.m. Brisbane time. I'm looking forward to daylight savings ending, to be honest, because I think it keeps everyone in the country on the same page. And we discuss things related to weight loss surgery. Each week we have a different topic and we explore different things that might come up for you after your surgery. Each week also, you have an opportunity to ask any questions you have about nutrition or health or things that you're experiencing in the BN bariatric group. So there's a couple of opportunities, and even people will just post their questions in the group and the community will answer. And then on a Tuesday night, I'll bring them into the live and we'll discuss those as well. So without further ado, this week we are talking digestion and the different impacts on digestion and even the anatomical changes that your body goes through after surgery and what that means for you. So I'm going to share my screen and I will show you what I'm talking about. Now, here it is. Why not sharing? So, there it is. I want to share this screen so I can show you something. So many windows open when I'm doing this. So I think you'll be able to see this image that I've found of the two surgeries. So the one on my left is a bypass and the one on my right is a gastric sleeve. So many of you would have had one or the other. You can see that the modifications that the surgery make to each given anatomical structure is slightly different, and it brings with it different implications. So I'll start with the bypass first. Bypass is exactly what it is. It bypasses this big part of your stomach here and reconnects your small intestine up here. So this becomes your new tummy, and then all down here is where your food goes. And it bypasses this whole part. So the offshoot of that is that obviously, yes, you have restriction in here. You have not much room to put food. You also have fewer gastric juices that will help to digest that food and break it down. So usually by the time your food leaves the stomach, it's got all the gastric juices are supporting it to help break down the food and assimilate it, so absorb it into your body and keep you healthy. So that changes in that a lot of that takes place in this lower part here in the small intestine, which is fine because that's where carbs are digested normally anyway. It just depends on what it gets mixed with up in this pouch area. So the digestive enzymes from like the pancreas and the bile duct and that sort of thing to break these things down and help us absorb our food. They're the enzymes that actually help us to break up food and make it into parts that our body kind of recognizes and knows what to do with. So that's where the malabsorption comes in. Caloric malabsorption, which means energy malabsorption. So that's good because that's what we're here for. But also nutritional malabsorption as well. So even if great, amazing food is going into this pouch, there are certain nutrients that won't be absorbed as well as they used to be before it all went through this whole longer process of digestion. So the key nutrients in a bypass patient are quite similar to a sleeve patient, but you will find that the bypass patients can suffer from more of the fat-soluble vitamins being deficient after their weight loss surgery. So fat-soluble vitamins are vitamin A, D, E, and K, and they all have vital roles in the body, as you would all know now. They are seeing some sleeve patients with vitamin A deficiency as well. So it's something to look out for in your bloods. But the general kind of crossover between the two surgeries are B12, iron, calcium, other key players. Vitamin D, you also need a lot more of after weight loss surgery. So those nutrients are totally bumped up in our BN multivitamin formulations so that you've got a good opportunity to take in what you need each day. Not only because you can't eat as much, but also with this malabsorption and restriction, you don't absorb as much. So with gastric sleeve here, you've got just a reduction in the size of the tummy, obviously, up to 70 or 80% is removed. Never to be seen again. That's taken out in this situation and it's irreversible. Bypass you can reverse, but it's tricky. So I urge you to stick with it. So gastric sleeve's the same. Essentially, it can leave you with low stomach acid, which means poor absorption of those key nutrients that rely on acid for absorption. Iron and calcium. So the key reason that vitamin B12 becomes a problem is that in this tummy area, in the actual stomach, is where you produce a particular protein that actually helps you to absorb B12, activate it and transport it. It's the transporting protein that actually helps B12 to function in the body. It's called intrinsic factor. And it's produced in this, actually in the part that they remove of the stomach and the part that they bypass in the bypass operation. So it means that your body has to be very clever, which it is, and come up with a different way of you absorbing B12. And it's not as efficient, but you still can do it, which is good. So they call that passive transport, which means that so before surgery, your needs for B12 as a general population individual is between 3 and 35 micrograms a day, because your intrinsic factor will pick up those tiny little micrograms and do what it needs to do with it. After surgery, you need 500 micrograms of B12 every day, just to make sure you're meeting your needs for that 3 or 35 maximum that you might need. So you can see that the newer mechanism for transporting B12 in your body is much less efficient, which is why we need the higher doses of these nutrients to actually smash it in there and basically get the job done. So that explains also why supplements from the supermarket and the chemist that are not designed for your new tummy don't have what you need in it, and that's why the bariatric BN multi devised. So we put them together based on the research into these new tummies that you've got, and I think there was about 40,000 people, bariatric patients, that were in a study that the ASMBS did in America. The American Society of Metabolic Surgeons conducted a study into nutrient deficiencies after weight loss surgery, and they found that these issues exist with these certain key nutrients, and from there they made recommendation as to each nutrient and its daily dose for a weight loss surgery patient to maintain good health. So our supplements will maintain your levels if you take them regularly, twice a day. However, if you do run low in something, which can happen from time to time, particularly iron, a lot of people take their multivitamins and they take an iron supplement alongside. You will need an extra individual nutrient if something does start to run low. But that explains the anatomy of what's happened to your tummy. And you know, what happens as a result of that. The other thing that we'll talk about is reflux. And you can see perhaps why that might start to happen if food is, you know, not breaking down fast enough, or it's different types of food will affect the way your sphincter, there's a lower esophageal sphincter, which is basically the lid on your esophagus. And so food comes down in through the esophagus here and into the stomach, and there's almost like a lid that keeps that food in where it should be. And it keeps also food from going into your airways. So different foods have different effects on the lower esophageal sphincter and will cause it to relax. So that's also an option for, it kind of gives rise to the opportunity for reflux as well. What else do I want to say about the anatomy after surgery? You can also see, you know, just what your restriction would be. You've almost got just a straight tube of, it's almost the same size as your intestines. So that's why chewing food really, really well is a key. And the reason for that also is that digestion actually starts in your mouth. And so when food goes into your mouth, your body starts to do 100 different things. But one of them is it goes, oh, here comes food, this very clever mechanism that we walk around in. And the salivary glands start to produce the first key enzyme that helps to break down your food in your tummy as well. It's called salivary amylase, is the first thing. So if you're bypassing the chewing and you're shoving food in too quickly, you're missing an opportunity to actually have your food digesting quite well. So that's why they say chew your food 20 or 30 times and then swallow it. There's many reasons for that. One of them is that it makes your food into smaller particles that your body can deal with. The second one is that salivary amylase gets mixed up within the food that's in your mouth and then swallowed, so it helps the digestive system. And the third thing is that the chewing sets off a whole lot of other biological responses and gets the body ready to digest the food. So it tells your brain that food's coming in. It also tells your pancreas and your liver and your gallbladder and everything that there's something going on and they need to get ready to digest this food. So it is very much a biological process, but it's also about enjoying your food and being present with it as well. They've proven that people who are relaxed while they're eating, or even they're enjoying their food, take a lot more nutrition from that food regardless of what it is. They actually just have the welcome mat out for the nutrients to come in. So that's why we chew our food thoroughly. It also gets, sets up protein to be broken down into smaller portions that can be used by the body more quickly, particularly in a malabsorptive state like you have here with the sleeve and the bypass. Anything you can do to help make it easy on your body to digest food is going to do you some favors. So that's my rambling on the anatomy of your new tummy. During the week, we did a poll. And this is, I love the sharing of the screen. This is the result: common digestive issues, lots of reflux, lots of irregular bowel movements. This is also to do with the enzymatic activity in both situations. And it's also to do with the fact that you need to eat a high protein diet now. So and irregular bowel movements, meaning loose one day and maybe constipated the next, can indicate some form of intolerance. So it's a good idea to have a look at when that happens and which foods you had during that time. 83 people said they had inability to tolerate certain foods. 59 had diarrhea and flatulence. That's a common thing with the bypass. 53 had dumping syndrome, which isn't much fun. 36 had indigestion. 36 had regurgitation. So talking about all of this. And 14 had celiac disease or IBS or IBD. So that can sometimes happen. There are links to that autoimmune trigger with bariatric surgery. So it's always, if you're having something strange going on, it's good to get it checked out and make sure that everything's kosher. Excuse me. So yes, reflux, there's a varying ways of looking at reflux from a medical perspective. A lot of patients will be sent home with reflux meds, and that's to help prevent reflux in a tummy that's just been operated on. So it is a good thing to do. If you don't experience reflux, there's no need to continue taking reflux medication, but always check in if you're changing anything with your team. But I do really support people using those medications with consideration, because they also block the same nutrients that you now have trouble absorbing. So they suppress stomach acid, which means the nutrients that are relying on stomach acid for absorption are not getting a look in. So B12 and calcium and iron, the same ones. So that's why I encourage you to really explore what's going on. If you are experiencing reflux, have a look at the foods you're eating, see if they're a key. The main players in that relaxation of the esophageal sphincter is coffee, all the fun stuff, coffee, things like tomatoes, nightshades, that sort of thing. Also alcohol definitely relaxes that esophageal sphincter, and a lot of people will get reflux after they've been drinking alcohol. And it's also sometimes the foods that we love to enjoy with a drink that cause that nice mixing pot of acidic fermentation. So looking at those kind of foods, sugar will also help that along. The state of your microbiome is another thing, and the amount of stomach acid you're producing is something to consider as well. So overall gut health, if you're experiencing reflux, my first thing to do is just take out processed food altogether, reduce the known irritants like gluten and dairy, all the other ones I just listed. Just stick with, fresh, clean food and see what happens. Always, if you're having reflux and you've had bariatric surgery, always check in with your team to eliminate the risk of it being a structural issue. Reflux can be linked to like hernia, twist, that sort of thing. So we always, when something changes and you've had surgery, you always eliminate the mechanical issues first and then go, okay, it's not that. Well, at the same time, you could probably eliminate all the processed foods and that sort of thing, but always have that ruled out so that you know what you're working with. Then you look at, what might be the cause. Are you not tolerating dairy as well as you could? Do you not produce enough hydrochloric acid to break down your food? That's the other thing, is now there's a lot of question around reflux, and is it an over acid situation or is it an under acid situation? So food will go into your pouch, and if there's not enough acid there to break it down, it's going to sit there for a little bit longer. If your microbiome's not on point, you will find that things can ferment like beer because there's yeasts and other bacteria that will work on that food, and it'll make you burp and feel bloated and feel gassy. And that's what we call fermentation. And it can be that you've just got an imbalance of these healthy microbes that support digestion, and you've got a too high a level of the yeasty festy guys, for a technical and scientific term. Could be that. And then we look at, there's not enough acid, and then to suppress the reflux, we put in medication that suppresses acid even further. So it can't be helping digestion. So it's looking at these things and understanding what might be at work. Then, and only you will know that from doing your diet diary and making sure you're paying attention to what you're eating and drinking as well. The problem is that reflux, if left untreated, becomes gastroesophageal reflux disease, and gastritis. So people do end up with inflammation in the esophagus, and we don't want that tissue there to be damaged over and over again. It's not a good thing. So then there's the way up of the medication is preventing this gastritis and esophagitis. Sorry, I should say it's more esophagitis than gastritis. And that's important. So what can you do? The other thing you can try is, of course, eliminate the processed foods. You can look at incorporating anti-inflammatory foods into your gut. Things like the collagen powder that we have online is fantastic. Bone broth, things with glutamine in them help to heal that mucous membrane. Vitamin A in deficiency, its job is to manage all of the mucous membranes in your body. So that's your gut. So looking at your nutritional sufficiency of all of those, vitamin C for your connective tissues in your gut, looking at vitamin A for also the integrity of your mucous membranes in your gut. So overall, those things will definitely contribute to making sure that everything's nice and strong. And also include things like soothing herbs like turmeric in your cooking, or have a look at slippery elm bark powder. And the other great product we have that walks off the shelf is called Motion Potion. And it's great if you're experiencing constipation, but it's also got heaps of carminative anti-inflammatory additives in it, which coat the lining of that entire from your mouth down through your esophagus down into your stomach. It can just protect it as well. So that's really something I would look at first. Increase fiber, build up those good bacteria, reduce things that don't work for you, and don't eat too much. Make sure you're eating small enough meals that you're not filling up too much, and then things are coming back at you. So looking at that, irregular bowel movements. I went on about reflux because it's a big issue. But yes, eliminate the mechanical issues first. So your team, make sure it's nothing that you should be addressing from a anatomical perspective. Look at your diet, keep an idea of when your reflux happens and which foods you ate anywhere up to 3 days before. Different reactions to food are not always instant. So it could be that it was 2 days ago you ate something and the body goes, I don't like it. And that's when you'll get the response. So diet diary is great because it tracks your symptoms and it also has a look at what you've been eating. Irregular bowel movements can be related to food, can be related to food intolerance, and also can be linked with just, too much refined food in the diet. Softer stools can indicate inflammation. If you're experiencing diarrhea on a regular basis, it's something to have a look into, because again, it's a malabsorptive thing and you'll be losing nutrients as well as electrolytes and that sort of stuff. So that's really one to watch. But yes, it could be that you've got a new intolerance to something that's going in. And constipation can be connected to overall things change from a digestive perspective as far as how long food takes to reach your mouth to your toilet. So looking at if you're not going to the toilet, every day, every other day, could be something to investigate. Some people are only going once a week, and that tells me that they could do with more things that would tone their digestive system, like regular walking and yoga, that sort of stuff, to help the nervous system to relax enough that you can pass a bowel motion. Hydration is one of the biggest, it's actually the biggest contributor to re-hospitalization for weight loss surgery patients soon after surgery. So looking at water intake and also fiber. When you've been told to eat protein first, and that doesn't leave a lot of room for everything else, you could look at supplemental fiber if you are constipated. We've got a great fiber on the website. A lot of people use the Benny fiber, that sort of thing. The one we stock has been shown also to increase, it increases a particular microbe that helps with calcium absorption. So you'll find, I think they did a study on our particular form of fiber, and it showed an increase in calcium absorption by about 12%, which is great for you guys because your calcium absorption goes from about 40% before surgery down to about 9%. So if you can gain another 12, that's full on bonus. So looking at that, inability to tolerate different foods can come down to the fact that you just don't have the particular enzymes present that will break it down. So in your tummy, you have lactase, which breaks down lactose, and a few other different pancreatic and digestive enzymes that their job is to actually almost clip on to here's lactose, and lactase actually clips onto it and makes it digestible. So if there's a lack in that, you'll find that there's a spillover that the lactose can't get broken down. So it does come out as diarrhea, cramping, that sort of thing. Different foods will do it for different people. And it's looking at, do you eliminate that food group? And is that a good thing? Or do you find a workaround like taking the lactase? Like you can take the digestive enzymes and support your digestive system that way. A lot of people have diarrhea and flatulence. Again, that could be linked to intolerance, diarrhea, inflammation, what you're eating. If you're eating processed food and protein, you'll find that there's not much to hold the poo together. The fiber is the thing that does that. So flatulence is also linked to A, what are you eating? B, are you fermenting? So is it going in and all sorts of things are happening to it and you're gassy and bloated and windy? And that's a microbiome issue, looking at gut health and what's going in. And also, I was going to say something else about that. I'll come back to it. And also some people who've had bypass particularly will experience loose bowel motions and problems in that area. And it's just a matter of kind of nutting it out with your team as well and working out what's going on. 53 votes for dumping syndrome. There's also a thing called late dumping, which means, again, it could have been food you ate 3 or 4 hours ago, and then suddenly you're coming up with weird symptoms like headache or dizzy or, you know, just feeling weird. And that can be a delayed kind of, it's generally a blood glucose related response to the food you ate a little way back. But generally dumping is related to bypass because things will just go whoop straight into the small intestine. If you're too quick or you're taking too much sugar, that sort of thing, you're pushing things into the small intestine that are quite undigested and not ready to go there yet. So the body goes, woo, I need lots of insulin. And it's almost like a shock response. It's not a lot of fun. Indigestion, I relate that back to the kind of similar causes for reflux. Regurgitation, that's not fun. And 36 votes, I didn't think it was as prevalent as that, can be linked to too much food too quickly, or things just not agreeing with you. Again, if there's not enough enzymatic activity and stomach acid and that sort of stuff, your body's like, well, I can't deal with that, and may reject it rather than having it sitting there. Some people also talk about the fact they'll make themselves regurgitate food when it's not comfortable. So it's, yeah, one of those things. Celiac, IBS and IBD are all autoimmune conditions, and they can be that they existed before surgery, or they might get triggered afterwards. So one key thing is to make sure you're maintaining your nutritional supplements and good food, just to make sure that your immunity is taken care of, and also making sure your vitamin D levels are good. Anyone with autoimmune needs lots and lots of vitamin D. So those sorts of signs that may be signs of celiac, IBS or IBD that didn't exist before surgery. So if you're finding that you've got pain or cramping constantly, or you're just not tolerating certain foods, or you're tired, or if you eat and you feel really tired, that can be a massive indicator for something going on, that you're like, oh, it's really hard work to actually take this through the digestive tract. So that's the poll. I'm loving the poll because it gives me an idea of what's going on, and then we can we can talk to it in the lives, and then we can give you more information. So the newsletter that's coming out tomorrow is all about reflux and digestion after weight loss surgery as well. So I'll go to the questions and I will stop sharing. There we go. Yeah, I did. I stopped sharing and I covered my comments. So the first question, 18 months, Kim said she's 18 months post-op and has just been hit with the first acute episode of reflux. Am I doing something wrong? I don't know if you're doing anything wrong. It can either be that things have been building up for a period of time and something's changed, or something that you ate or didn't agree with you that day. It would be good to hope that it's your first and only acute episode of reflux. But also, like I was saying, have a look at what you ate up to 2 or 3 days ago and see if anything's changed, and have a nut out of whether you need to have a look at maybe eliminating a couple of different things, to like lactose or gluten for a little while, or alcohol, or even cigarettes will give you reflux. They mess up your gut even though you breathe it in. People who smoke have quite a impact on the microbiome, and the population of the different microbes in your gut are affected, and they can cause low stomach acid and reflux. So all sorts of things will be contributing to that. Keep an eye on it, Kim, and yeah, if it's happening, if it's starting to ramp up, get onto it early and pop in and see your dietitian or your team. Leanne says, I'm on Somac in the morning and Nexium at night. I've tried to wean off and the reflux burn returns, with me running for dairy to cool it off. I know there is issues with absorption of some nutrients and concerns of disease of the esophageal with PPI use. Can you help with dietary advice to assist in getting in the decreased nutrients, please? I've also had episodes where I wake up aspirating on gastric juices that I continue to cough up. That's not fun and it's quite scary. Fortunately, not that often, and I've learned not to eat too much before relaxing. Good thinking. It's happened in bed, lying and sitting in a chair taking a nap, and it can be that it's just too much pressure straight after food. So they're recommending 3 to 4 hours before bed. If you are experiencing reflux, the best thing to do is to back off the food as far back as you can before you go to bed. And looking at dietary advice to assist in getting the decreased nutrients in. With your PPIs too, if you do have to take them, please make sure you don't take your multivitamin within 2 hours. So if you do Somac in the morning, then you do your BN multi maybe mid-morning or lunchtime, and then dinner time, and then you have your Nexium at nighttime. So they're always 2 hours apart, because the Somac and the Nexium will block all the nutrients in there. So it's more of way of, if you're doing these PPIs on a regular basis, it's more about making sure you're getting your bloods checked every 3 months. If you're doing it regularly, I would monitor just to make sure that nothing's falling down, and always have a look. Ask your doctors for where you're sitting in the range. A lot of people will be right at the bottom end of the range of the normal range, and they'll go, yeah, you're fine. So ask for your results if you can get a copy of them, so that way you can keep an eye on anything that's changing. If something's, for me, sliding down to middle of the range, I'd want it kind of further up than that. So some of the ranges are really broad too. So if you're in range and isn't that good, it could mean that you're just on the tail end of the normal range. And you could feel 100 times better if you were up a little bit higher. So asking the questions about your bloods is important, but definitely also with the PPIs and calcium, always ask for a indicator of the calcium in your bloods. Is lovely to know about, but it could be calcium from your bones. So ask them if they know that that's, your food calcium and your supplemental calcium floating around in there, or how do they tell where the calcium is coming from. Because when calcium's low in the diet, the bones will release it to keep your heart beating as well. It's a very important little nutrient, that one. So I think I covered different nutritional things to do with reflux. And also you could start with, if you wanted more protective mechanism, you could add in like the slippery elm bark in the morning or something like that, and start to kind of reduce inflammation if there's any there and kind of prop up the microbiome. And then you can look at weaning off, if you can, the Somac and the Nexium if that's your intention. But always do it with your doctor or your dietitian to let them know what your intentions are and you're working towards something, and then they can manage you that way as well. But yeah, definitely looking at the triggers. Next one is Bernie. I went off Nexium for a while and was having some chest pain, and some tests, my doctor said it was reflux, and I'm back on the Nexium but still suffering. I think it would be interesting to see what foods we should be mindful about eating. I might put in the group a few, just a list of things and the reasons why they're good. So there's different foods that will support your microbiome. So they're good to know about. Like bananas are really prebiotic. They help the good bacteria to thrive, and asparagus is particularly good, and so is artichoke. So there's different veggies and fruit that we eat for different reasons when we're working on something. So I'll stick that in the group during the week and you can cook to your heart's content. So the next question Trudy's asked is, could you please cover the correct way to take vitamin supplements to ensure the best therapeutic levels and absorption is achieved? Good question. And I covered a bit of that up the top with the image of the bypass and the sleeve. Basically, if you're taking your multis, take them away from caffeine by about 2 hours, either way, either side. A lot of people have their multi with their coffee in the morning, and I'm trying to steer them away from that. It blocks iron absorption, caffeine, and different nutrients will start to compete. So if you take your BN Chew, which has calcium in it, and you're adding, and your dietitian has got you taking BN Cal to boost your protein levels, your calcium levels, take your BN Chew, and then a few hours later take your BN Cal. Or if you're taking a large dose, like some people will buy a calcium citrate in a 500 milligram or 1,000 milligram, which is fine, but never take it with your multivitamin because it will block the iron in it. Anything over about 500 milligrams will block iron, which is why we can have calcium and iron together in the multi, but any more than that won't be good. So take your multis in the morning, take them away from caffeine, take them away from other larger calcium supplements and that sort of thing. Also check with your doctor if you're taking medications, when you should space them out as well. Some medications need to be taken away from different nutrients as well. So that's depends on what you're having. But generally, if you're taking BN multi and you need iron, you would spread them out as well. So sometimes if I need extra calcium throughout the day, I'll put that in just before bed, and that also gives you a good sleep because it helps you to relax. It's a lot to do with the nervous system and the cardiovascular system and that sort of thing. So it will help you rest well. And it means that it's not competing with anything overnight. Another thing is if you're looking to boost iron, and you can put it in on an empty stomach, it's good. Sometimes I'll get patients to do that just before bed if they need, another 60 milligrams of iron. If they've got iron deficiency, they can take their multi during the day and then take the bigger dose of iron at night and sleep on it. And that also will, if big doses of iron do make you feel nauseous, you can sleep through it if that's the case. And then, yes, Trudy was just asking about to ensure the best therapeutic levels and absorption is achieved. The other thing is to take your your multi with some food. So the fat-soluble vitamins have got some fat to go in with as well. Add a little bit of, ghee or olive oil, that sort of thing to your meals. And the fat is helpful for digestion or storage and transport of the fat-soluble vitamins as well. So that's quite important. So Donna asks, I've just had blood tests done, but waiting to see my GP for results on the 19th. But the last couple of weeks I've been feeling really off. I get a bloated stomach. I'm really tired and I'm sleeping at every opportunity. I've got a depletion in my energy levels, big time. My bowel movements are pale and I've put on 3 kilograms. I'm also getting discomfort in the upper abdominal area whenever I have anything to eat or drink. Any suggestions as to what I can do to improve things? This speaks to me a little bit about perhaps a little bit of gallbladder-ish digestive upset. I'm not diagnosing anything, but pale stools are linked to fat malabsorption. So it could be that there's either too much fat in the diet or too much kind of processed flours and that sort of thing. So looking at really cleaning up the diet and removing anything that isn't fruit, veggies, or meat, basically. And yeah, making sure you're reducing those processed flours, that sort of stuff, if they're in the diet to begin with. The pale stool can be linked to gallbladder not producing enough bile to emulsify the fats and to make them utilized in the body. So then they'll pass straight through and it will make your poo look pretty pale. So that could be a link. But yeah, definitely in the meantime, look at also if you're tired, and if you're particularly tired after a meal, it's like it's a drain on your body to be eating. So the digestive system must be working overtime. Make sure you're getting your multi in, because that will help with energy production. The B group, also the B's, protein, those sorts of things. B group, magnesium and protein, amino acids are really relied upon by the liver for good detoxification of the body as well. So you're making sure all your nutrients are in good supply. Also check out the weight gain. Is it inflammation that you're storing fluid, or is it that you're gaining weight? Then has your diet changed? Is there a link to that? Also, pain in the upper abdominal area. I don't know if it's left or right. So yeah, I'd definitely be, what's 10 days away. If this continues for too much longer, I would pop into the ED and just get it assessed. The doctor's not helping and it's the 9th today. I don't think I'd sit around on it for 10 days and see what happens. And they can just check it out and see if there's anything else they need to do. Particularly if you're in pain when you're eating and drinking, it's not a good thing. And anything that changes like this should be checked out straight away. And that's what the hospitals are there for. Anyway, you could also look at diet, making sure you're boosting fiber, liquids, water, that sort of thing. And again, eliminating the processed foods. So Chris Sula said she's feeling hot after eating, which can last up to 10 minutes. What's wrong with me? And so many people said, yeah, I get that too, or I sneeze, or my nose runs, and it's linked to your sympathetic nervous system a lot of the time. And it can be when you're eating too quickly. The body goes, whoa, what's going on here? And it can set off there's also, I'll post something in the group about the vagus nerve and its involvement with eating and the brain and particularly after weight loss surgery, it can be something that's a bit triggered. So yeah, it could be that you're eating too quickly or that you're eating too much. And a lot of people mentioned in that post that that's their kind of barometer of, okay, I've eaten too much, I'm sneezing, or I've eaten too much, my nose is running, or I'm feeling really hot. So those are signs of something that's being tipped over. So have a look at when it happens and if it's particular foods that are causing it, and kind of how you're eating at the time. So next we're going to move on to Transformation Tuesday and the winners. So I'll go back to the share, which is down here this time. Just share the screen. There we go. Share this screen. I'm sure you can see that. So here's the winners. Wow. I'm happy now I've worked out the sharing that I can show you these pictures. When you start to lose weight, you also gain a mask, it seems, this year. So Cara is 2.5 years post sleeve. She's lost 80 kilos. Started doing belly dancing 2 months ago to help me tone up excess skin, as I'm unable to go to the gym due to injuries. It's low impact and it's loads of fun. Oh God, here's my software driver loading. Which is amazing. Who would have thought you'd be a belly dancer 2 years ago? So this week, the winners get to take home one of these Easy Snacks stainless steel. So you've probably, I know you've all got one, the Easy Snacks tower to take your snacks and stuff around in. These are the insulated versions. So you get a big one, a medium-sized one, and a small one, but they're all keeping your food cold or keeping it warm for a period of time. And they're particularly handy. So this week's winners, if I called out your name, like Cara Beggs, could you send us an email to support@bnmulti.com and let us know that you won a prize. What we're also doing is compiling all these inspiring people to fill out this form that will tell us your story in depth. And then on our website, there's a new tab that's called BN Inspired Stories. And in there, you'll find heaps of incredible recounts of everybody's journey, what brought them there and what happened for them and, you know, what they're doing now. And it's a great resource for people who are either looking at doing the surgery and not quite sure what it might bring for them, or if you're having a crappy old day and you're feeling a bit stuck, you can have a look and see how other people have gotten themselves through the journey and keep you hanging in there. So the next one of our winners is Kath Kelly. She sent us a photo of her birthday 2 years ago, and then this year 32 kilos down. She said, it's something I should have done years ago. I feel fabulous, and you look fabulous too, and that's a beautiful color on you. So you've won a prize too. You won this guy here, this one. And considering this month we're talking snack smart ideas, these will be showcased throughout the month, so you'll have heaps of opportunities to pick them up. But they're good to carry around. You know, you could wrap up sliced meat, little cherry tomatoes, that sort of stuff. Put your nuts in there, fresh fruit, whatever. They're brilliant. And they're all leak proof, so you could put that whole tower into your handbag or your, you know, in the bag that you take for your food, and you know that it's safe in there, it's not going to leak. So that's the winners for this week. Stick around for the newsletter tomorrow. Stop sharing, and we'll talk more about digestion, and we'll also showcase a few more snack options and that sort of stuff. It's looking really good. So hang in there, have a wonderful week, and also don't forget to post your questions for us so we can keep the conversation going. Join us next week. We're doing bone health, and there's another little topic in there which you'll see throughout the week. We'll advertise it in the group. So stay healthy and have a great week. Take care. See ya.